Hi, and welcome back to my channel, Learning Biology with Dr. Vanessa. In today's video, we're going to take a look at blood pressure. What is blood pressure? Blood pressure is the force your blood exerts on the walls of your blood vessels as it flows. Think of it like water flowing through a garden hose. Too much pressure and you've got problems. Too little pressure and nothing's getting watered. We're going to take a closer look at exactly what blood pressure is and why it's so important to maintain normal blood pressure throughout the body. So again, blood pressure is the force your blood exerts on the walls of your blood vessels as it flows. This pressure is important because it allows the arteries to bring blood all throughout the body. However, if blood pressure is too high, it can cause health issues, and if blood pressure is too low, then we're going to decrease the amount of blood that can get to the organs and tissues. The two key players of blood pressure are systolic and diastolic pressure. Systolic is the top number. It measures the pressure when your heart squeezes. Diastolic is the bottom number. This is the pressure when your heart relaxes. In order to monitor blood pressure, we can measure blood pressure using a sphygmomanometer. This is a fancy word for the cuff and gauge combo. In addition to the sphygmomanometer, we also use a stethoscope that is placed underneath the sphygmomanometer in order to listen to the sounds of the heart. Those sounds are known as the sounds of Korotkov. What happens is the cuff is filled with air in order to compress the brachial artery. This stops the blood flow. Once it compresses that blood flow and no sounds are heard, the cuff pressure is going to be released. The first sound that is heard is systolic blood pressure, or that top number. This is the force of the blood pressure on the arterial walls that happens just after ventricular contraction. I gave you an easier definition before, but this is the scientific definition. The last sound that is heard is the diastolic blood pressure. This is the force exerted by blood remaining in the arteries during the ventricular relaxation, so when those ventricles are relaxing. The ideal range for a healthy adult is about 120/80 millimeters of mercury. Anything outside of that can signal trouble. High blood pressure, or hypertension, can strain your heart, damage blood vessels, and lead to serious issues like strokes or kidney disease. Hypertension is defined as a sustained arterial blood pressure of 140/90 millimeters of mercury or above. Rising diastolic pressure, which is that pressure on the bottom, is generally indicative of progressive hardening of the arteries. Since the heart must work harder to pump blood against higher pressures, there is increased risk of a cardiovascular accident the higher blood pressure becomes. Because remember, blood pressure is going to be the pressure that is in those arteries. And in order for the heart to pump blood all over the body, the left ventricle has to have enough pressure to overcome the pressure in the aorta so that blood can actually flow through the body. So the higher that pressure in the aorta becomes, the higher blood pressure becomes, the harder the left ventricle has to work in order to push the blood through the aorta. So the higher a person's blood pressure is, the harder the heart is going to have to work in order to pump blood all over the body. Primary hypertension, or essential hypertension, is a condition where blood pressure is consistently high, but the exact cause is not identifiable. It develops gradually over many years and is influenced by several factors, including genetics. A family history of hypertension can increase your risk. Age. Blood pressure tends to rise as people age, with a higher risk over the age of 40. Lifestyle factors, for example, poor diet, such as high intake of sodium, saturated fats, or even deficiencies in potassium, calcium, or magnesium. Lack of physical activity, obesity, excessive alcohol consumption, and chronic stress can also contribute. Unlike secondary hypertension, which results from specific underlying conditions such as kidney disease or hormonal disorders, primary hypertension is not directly linked to a single cause. It's typically managed through lifestyle changes and, in some cases, medication. Hypotension is low blood pressure. Now, low blood pressure is not normally a threat. Actually, low blood pressure is generally associated with a lower risk of cardiovascular accidents and a long life, providing that the tissues are adequately perfused. However, when blood pressure becomes abnormally low, then that's when it becomes a problem. And what are we talking about with abnormally low blood pressures? It becomes an issue when the force of blood against the artery walls is too low to deliver enough oxygen and nutrients to vital organs. And this is something that happens when there's a sustained systolic blood pressure of below 100 millimeters of mercury. Now, when blood pressure is too low to be able to give organs their vital nutrients, this can lead to symptoms such as dizziness, fainting, fatigue, blurry vision, and in severe cases, shock. So normally, low blood pressure is not a bad thing. It's when it becomes abnormally low that it can be an issue. Hypotension can result from dehydration, blood loss, or underlying health issues like heart or endocrine problems. Treatments are going to focus on addressing the underlying cause and may include increased fluid intake, dietary changes, or medications to stabilize blood pressure. Now that you have an understanding of what blood pressure is, let's talk about some factors that affect your blood pressure. The first one we're going to talk about is peripheral resistance. This is the resistance to blood flow in your arteries. When blood cells and plasma are flowing through the arteries, they are going to encounter resistance when they contact the blood vessel walls. If resistance increases, then more pressure is needed to keep blood moving. And there are going to be three main sources of peripheral resistance. This includes blood vessel diameter, blood viscosity, and total vessel length. When blood vessel diameter decreases in size, it's narrow or it's constricted, this is going to increase resistance. This raises blood pressure, while wider vessels are going to decrease it. With blood viscosity, the more viscous blood is, basically it would have less water and more of those proteins in it, that would increase blood pressure as well, or increase the resistance and increase the blood pressure. And then the total vessel length, the longer the blood has to travel throughout the length, would also increase resistance and it would increase blood pressure. The next thing that can affect blood pressure is vessel elasticity. Healthy blood vessels stretch to accommodate blood flow. When arteries lose that elasticity, often due to aging or disease, they can't expand as well, and this leads to higher blood pressure. Another reason that blood pressure can also increase with age. Another factor that can affect blood pressure is blood volume. The total amount of blood in your circulatory system matters. If blood volume increases, like let's say from fluid retention, then blood pressure rises. So the more blood volume, the more blood pressure. And on the other hand, if blood is lost or dehydration, so less water, less blood volume, this can lower blood volume and therefore lower blood pressure. And then finally, we can talk about cardiac output. Cardiac output is the amount of blood your heart pumps per minute. When your heart pumps more forcefully or faster, this is going to increase blood pressure. A weaker or slower heart is going to reduce it. There is also neural regulation of blood pressure. The cardiovascular center is found in the medulla oblongata, which is found in the brainstem. Baroreceptors, which are receptors that are sensitive to changes in blood pressure, are found in the aortic arch as well as in the carotid sinuses. If blood pressure increases, the baroreceptors are going to detect this change and they are going to stimulate the cardioinhibitory center to decrease heart rate and the vasomotor center to increase diameter. These things are going to help to decrease blood pressure. On the other hand, if there is a decrease in blood pressure, then this is going to stimulate the cardioacceleratory center to increase heart rate and the vasomotor center to decrease diameter. These things are going to allow blood pressure to increase. Now, this is not just going back and forth all the time, but this is helping to maintain that steady, healthy, normal blood pressure and ways that the brain and body can interact to allow this to happen. In addition to those baroreceptors that can monitor pressure changes, there are also chemoreceptors. These chemoreceptors are going to be sensitive to changes in carbon dioxide and oxygen in the blood. These chemoreceptors are found in aortic bodies and carotid bodies. If there is an increase in carbon dioxide or a decrease in oxygen, these chemoreceptors are going to detect that, and they are going to stimulate the vasomotor center to decrease diameter or vasoconstrict the blood vessels to help increase blood pressure. If there is a decrease in carbon dioxide, this is going to stimulate the vasomotor center by triggering those chemoreceptors, and those chemoreceptors are going to stimulate the vasomotor center to increase the diameter or vasodilate the blood vessels in order to decrease blood pressure. There are a variety of hormones that can also regulate blood pressure. This includes the renin, angiotensin, aldosterone system. When blood volume falls or the blood flow to the kidneys decreases, renin is secreted by the kidneys into the bloodstream. Angiotensin 2 is then triggered by renin and it raises blood pressure. Angiotensin 2 can also stimulate aldosterone secretion, which also helps to increase blood pressure. Epinephrine and norepinephrine are other hormones that can be released. They are released by the adrenal medulla in response to sympathetic stimulation. This increases cardiac output by increasing the rate and force of heart contractions, and it also increases heart rate itself. There's also antidiuretic hormone, which is known as ADH, abbreviated ADH, also known as vasopressin. This hormone is produced by the hypothalamus and released by the posterior pituitary. It is released in response to dehydration or decreased blood volume, and it can cause vasoconstriction, which increases blood pressure. It also allows more water to be absorbed in the kidneys, which also increases blood volume. And then there's atrial natriuretic peptide, or ANP. This peptide is going to be released by the cells of the atria within the heart, and it can lower blood pressure by causing vasodilation, and it promotes the loss of salt and water in the urine, and this helps to reduce blood volume. Circulatory shock is a life-threatening medical condition where the circulatory system fails to deliver enough oxygen-rich blood to meet the body's needs. In this case, the blood vessels inadequately fill to enable normal circulation in order to supply oxygen and nutrients to the tissues. Because of this, it may result in death of cells and damage to organs. There are different types of circulatory shock. The common types include hypovolemic, which is severe blood loss, cardiogenic shock, which is where the heart fails, vascular shock, which is inappropriate vasodilation of the blood vessels, and then obstructive shock, which is due to obstruction of blood flow. The body's responses to shock include activation of the renin-angiotensin-aldosterone system, which helps raise blood pressure. Also, the secretion of antidiuretic hormone, which causes vasoconstriction, which can increase system vascular resistance and also increase blood pressure. Activation of sympathetic division of the autonomic nervous system, which intensifies vasoconstriction and also increases the heart rate and contractility, all of which are going to help raise blood pressure. This is all working to raise blood pressure to get blood to where it needs to go. Release of local vasodilators can help restore oxygen levels to normal, but it can be harmful by decreasing systemic vascular resistance and thereby lowering blood pressure. If blood volume drops more than 10 to 20%, or the heart cannot bring blood pressure back up, adequate blood flow to the tissues may not be maintained. At this point, shock becomes life-threatening as damaged cells start to die. Thank you so much for watching my video. I hope that it helped you better understand what blood pressure is and why it's so important. If you enjoyed this video, please make sure to subscribe to my channel and like this video to help bring others to this channel as well. If you have any questions, please make sure to put them in the comment box below. As a special added bonus, teachers, I have a set of notes that can be used along with this video. You can find it on my Teacher Pay Teacher store. The link is in the description box below. Thank you.